Contents of this program is symptoms of diabetes and behavior determines the prognosis of the disease and the fate of the person. Early detection and early treatment will make it easier to recover.
Hello everybody. This is the medical program of Reiwa Medical Conference. This is Mr. Ohno, who is a Japanese doctor. Today, we introduce about diabetes to you. Please presentation.
Hello everyone, I'm Dr. Ohno. This is Dr. Ogura. And today, we present about the information of diabetes mellitus and medical questionnaire. And if you want to know about more about diabetes, please access to the introduction of this program. Here, you can download the contents and medical questionnaire of diabetes free in English, Spanish, Chinese, Portuguese, Tagalog, Malay, Russian, Vietnamese, Hindi, Thai, and Korean. Then let's start. And first, today's theme is the truth of diabetes mellitus and a way to prevent it. First, I shall introduce you some short fantasy written by I. This is a fantasy, however, it's a true story, I believe. The bravest ancient agents in human history. Long ago, very brave people set out to trick. What were they seeking? Money, political power, or forced to kill their neighbors? No, they were seeking hopes and dreams, happiness and peace. And what was the result? They reached Asia and America, but they also gained some genetic traits in return. This is a map of ancient Asian people. They have started from Africa and long way to Asia and America. Some traveled long distances overland and others by distant sea routes. It had been difficult to get food during the trip. Many people have died from starvation. Only the obese people who could store energy survived. Because there were fewer calories, those prone to diabetes also survived. As alcohol was unavailable, many people became unable to drink or break down alcohol. Their diet consisted mostly of grains, nuts, fish, and vegetables, sometimes corns, and no fatty meat was eaten. These people adapted to live on grains, nuts, and seafood, and vegetables. I can say local food. Those are the foods they have eaten. For these reasons, these people have genetically acquired the following traits. They are prone to gaining weight, prone to developing diabetes, and unable to break down alcohol quickly enough, which causes the carcinogenic substance acetaldehyde to be produced, causing their face turn red. In other words, they are sensitive to alcohol. Eating fatty meats and lots of food makes them prone to developing diabetes and obese and metabolic syndrome-related diseases. Those are the descendants of the ancient heroes, Chinese, Filipinos, Indians, Belu era Belau, Native Americans, Korean, Mongol, Malaysia, Yakuti, Inuit, Ainu, Japanese, or Vietnam. On the contrary, Caucasians stayed their home countries and developed the agriculture and dairy farming. They have eaten fatty meat and its processed products and adapted to high-calorie foods and animal fats. That's why Caucasian people are less likely to develop diabetes, even if they eat a lot and gain weight. After globalization, many diseases and foods such as measles or American-style foods like greasy meats or processed meat products and alcohol have been exported to Asian countries or Asian ethnic. Asians are genetically different from Caucasians, so American lifestyles and foods are generally harmful to Asian ethnic. The Western lifestyle is also harmful to the natural environment and our planet Earth. This is one example. In Okinawa, in Japan, tofu, seafood, seaweed, and vegetables and rice were staple foods, with pork being an exceptional treat. At that time, Okinawans had the longest life expectancies in Japan. However, after World War II, when Okinawa came under the control of the US military, a Western-style diet took hold, leading to a dramatic decline in average life expectancy and a sharp increase in diabetes and metabolic syndrome-related diseases. This is a Japanese example. The people in Belau or Belau also have eaten seafoods, local vegetables, fruits, and coconuts. However, as a result of colonial rule and intervention by various countries like Okinawa, Japan, the Belau people have begun to eat high-calorie foods such as greasy meats and processed meat products. For this reason, many people gained body weight and about 40% people suffered from diabetes. Now, the most important key persons are mothers. As mothers usually make each meal, children's eating habits and preferences are determined by their mothers. Meats are tasty, and a Western style of life looks happy, prosperous, and progressive. However, to tell you the truth, Western style of living is very dangerous not only to some ethnic groups but also to the natural environment. To prevent metabolic syndrome and diabetes, it is important for mothers to provide their children with a healthy diet. However, extreme diets are not sustainable. Therefore, it is important to eat plenty of low-calorie foods like vegetables, fruits, and fish to make them feel full. Locally grown foods are fresh, safe, and do not contain the dangerous additives used in imported foods. Contents of this program is symptoms of diabetes and the 3 major complications. Do you fit the following symptoms? If you do so, you may or you would have diabetes or metabolic syndrome-related diseases. Now let's check out the medical questionnaire. Do you have the following symptoms? First, asymptomatic, feeling thirsty, drinking a lot of water, going to the bathroom more often, urinating a lot, waking up at night to go to the bathroom, nocturnal enuresis, weight loss in children, failure to thrive, weight gain, difficulty seeing, have suddenly become unable to see, increased number of self-inflicted accidents, not noticing injuries, dizziness and vertigo, numbness in the hands and feet. You tend to trip or fall easily. You have urinary incontinence or fecal incontinence and erectile dysfunction, angina pectoris or chest pain, myocardial infarction, aneurysm, cerebral infarction, cerebral hemorrhage, dementia, proteinuria, hematuria, albuminuria, renal failure, dialysis. Wounds tend to suppurate. You tend to catch colds easily. Periodontal diseases. You have cancer. You get tired easily. Lethargy, loss of libido. You have reached menopause. You are over 65 years old. You are trying hard to diet. You snore. You experience sleep apnea. Medical history and family history. It means blood relatives have the following: obesity, diabetes, gangrene and necrosis of fingers and hands and feet, sudden blindness, kidney disease, dialysis, stroke, dementia, high blood pressure, heart disease, premature death, sudden death, hyperlipidemia, fatty liver, preference for sweets, carbohydrates, and fats, mother's preference for sweets, carbohydrates, and fats. Occupation, your job, full-time housewife, desk work, work from home, non-regular employment, without health check, unemployed, recluse, and then exercise or sports. Hate walking, you hate exercise, you prefer to stay still. Your preferences: often eat sweets, love sweets, often drink soft drinks and juice, love rice, bread, udon, and noodles. Those are carbohydrates. Love ramen, love greasy foods, meat, fried foods, do not eat vegetables, fruits, or fish. Eat quickly, drink the ramen soup, love salty foods, love strong seasonings. And about smoking, drink alcohol, face turns red when drinking, personally use supplements, health books, and functional foods. And about medical, high blood sugar, high HbA1c, gestational diabetes, fatty liver, high visceral fat, high BMI, body mass index. BMI is calculated by body weight kilogram divided by height meter 2 times. It is normally 18.5 to 25. High blood pressure, and your cognition and behavior. Stop or adjust medication based on own judgment. Do not go to hospital even when abnormalities are detected during health checkups. Have not had a health checkup. Have never visited a hospital or clinic. Dislike medicine. Dislike doctors. Pharmaceutical companies cannot be trusted. You believe doctors cannot be trusted. You are fond of unfounded health books. Believe in religions, gurus, and alternative medicine more than doctors. Do not listen to family or others. And then explanation of the medical questionnaire. Asymptomatic. Please remember, diabetes is asymptomatic in the early stage, and if you feel thirsty or have to drink a lot of water, frequent urination, it usually means symptoms by hyperglycemia and osmotic diuresis of diabetes mellitus. And if you have weight loss in children failure to thrive, it is sometimes due to dehydration and muscle loss caused by hyperglycemia and osmotic diuresis. And if you have weight gain, you have a risk of type 2 diabetes and metabolic syndrome-related diseases. And if you have difficulty seeing or have suddenly become unable to see or increased number of self-inflicted accidents, it may be because of diabetic retinopathy, diabetic cataracts, decreased brain function, retinal detachment, fundus hemorrhage by diabetes mellitus. If not treated quickly, you will lose your sight. And if you are not noticing injuries or having dizziness or vertigo or other symptoms like below, it might be because of diabetic neuropathy, decreased brain function, or might be because of aging. And you have to remember, you become less sensitive to pain if you have diabetes. And if you have angina pectoris or myocardial infarction or dementia, it might be diabetic angiopathy and glucose denatures proteins in blood vessels, which causes damage to blood vessels. And it might be result in diabetic retinopathy, neuropathy, and nephropathy. And if you now have proteinuria, hematuria, or renal failure, or having a dialysis, it is because of diabetic nephropathy. And if your wounds tend to suppurate and you tend to catch cold easily, you may have a weakened immune system due to diabetes. And if you feel tired or exhausted or lethargy or loss of energy, loss of libido, it might be because of dehydration, lack of energy, neuropathy due to diabetes. If you have reached menopause, please remember, some menopausal symptoms are similar to those of autonomic nervous system imbalance due to diabetic neuropathy. After menopause, as estrogen level is down, women tend to be affected by metabolic syndrome, such as hypercholesterolemia, diabetes, and fatty liver, etc. And if you are over 65 years old, you are at high risk for diabetes and other conditions. If you are trying too hard to diet, if you are too thin, you usually have impaired glucose tolerance, which might cause diabetes. And if you snore at night or experience sleep apnea, it is high risk of obesity, metabolic syndrome-related disease, cardiovascular disease, and death. If children snore, they may have adenoid hypertrophy and need adenoidectomy. Those are medical history and family history. If your family member have obesity or diabetes, please remember, type 2 diabetes and metabolic syndrome-related diseases are usually hereditary. And about occupation, job, if you are not working a lot and do not do physical exercises, you are prone to lack of exercise, and it is a high risk of obesity, metabolic syndrome-related diseases, and diabetes, sarcopenia, and osteoporosis, and bedriddenness. and your preferences. If you often eat sweets a lot or drink a ramen soup or anything, those are high risk of obesity, metabolic syndrome-related diseases, diabetes, and high blood pressure. And about smoking and drinking alcohol. If your face turns red drinking alcohol, this means you lack the enzyme that breaks down acetaldehyde. And acetaldehyde is a carcinogen. If you use supplements or health food, it may be a high risk of cancer or other health problems for self and family, especially babies and children. Please consult with a doctor if you want to use supplement. And about a medical condition, if you have high blood sugar already, you may be at high risk of diabetes and metabolic syndrome-related diseases or already have them. And your cognition and behavior. If you stop or adjust medication based on own judgment, or you don't listen to your family member, such person does not visit hospitals, and the patient's disease will not be discovered, and any disease is likely to become severe, and it tends to be too late to recover. And then basics of diabetes. First, Asians are prone to insulin depletion and diabetes. 2. Dry mouth, excessive drinking, and excessive urination are usually the first symptoms of diabetes. 3. Elevated blood glucose is a cause of all complications. 4. Glucose binds to proteins in the blood vessels and causes degeneration, which induces complications. 5. Three major complements are neuropathy, nephropathy, and retinopathy, and it causes loss of vision, necrosis of feet and hands, and kidney failure, leading to dialysis. Please remember, insulin remains in patients of type 2 diabetes, and it can be managed through early detection and treatment. However, it is difficult to detect early because there are almost no symptoms in the early stages. And in case of type 1 diabetes, the beta cells of the pancreas are destroyed, and the insulin will be completely depleted. So, insulin supplementation is essential to live because destroyed beta cells do not regenerate. In both type 1 and type 2, nutrients necessary for life, and in children, nutrients necessary for growth should be consumed in a balanced manner. And as long as you are under good control, there are no foods that should never be consumed. Dietary basics. Avoid juices and soft drinks that contain large amounts of glucose and sugar. Do not consume carbohydrates alone, but together with protein and fat, and consume vegetables and dietary fibers as well. When blood sugar is low, when you feel hungry and there's no sometimes before a meal, sweet soft drinks and fruit juice are good therapeutic options for hypoglycemia. And if you are obese, you can get closer to your ideal weight with exercise and diet therapy. Please remember, thin bodies are more likely to develop impaired glucose tolerance. So, too excessive dieting is not recommended. And then cognition, thinking, emotions, and behavior determine the prognosis of the disease and the fate of the person. There is a bad example. Person A, during a health check, his blood sugar level was high and he was advised to see a doctor. His cognition, do you suspect I have diabetes? And his thoughts was, I don't have any symptoms, so there's no way I have diabetes. And his emotions, I hate medical checkups and doctors because they say unpleasant things to me. And his behavior was, I never go to the doctor. And the result was, a few years later, his leg became necrotic and he had to have it amputated. He lost his sight and he had to start dialysis several times a week. And then, good example, person A, during a health checkup, his blood sugar level was high and he was advised to see a doctor. Cognition, do you suspect I have diabetes? He thought, I don't have any symptoms, so I don't think I have diabetes, but still, I'll go to the doctor just to be sure. And his emotions, I hate medical checkups and doctors, but I'd be in trouble if I really did get sick. And his behavior was, I have no choice but to see a doctor. and the result was he was diagnosed with early-stage diabetes. But fortunately, he followed the doctor's instructions and lived into a ripe old age. Key points. In fact, those persons are identical twins. Of course, this is virtual cases. Their genes are just the same. Their face, birthday, ethnicity, home country, parents, food, nurturing environment, all those factors were equal. Despite the same genes and circumstances, the results have been completely different. Remember, it is not physiognomy, horoscope, birth date, ethnicity, or religion, or country of origin that decide human destiny. Far more important determinants are recognition, thought, emotion, and deed. Please always analyze your cognition, thoughts, emotions, behavior, and results. Make effort to continue improving them. Doing so will make you less likely to get sick. Even if you get sick, early detection and early treatment will make it easier to recover. Your destiny will definitely improve. This is cognitive behavioral therapy for life. November 14th is World Diabetes Day. It is established by the IDF and WHO. We hope you will use this video, summary, and questionnaire to promote early detection and treatment of diabetes. Thank you for joining us.
Thank you for your presentation. May I ask some question?
Okay.
First, is diabetes permanent disease?
First, type 1 diabetes is permanent. We have to continue the treatment all over his life. However, in case of type 2 diabetes, if you can find it in the early stage and do a very severe exercise and diet therapy, you may not use a medicine or you may recover.
Second question, is it true that diabetes can be cured by losing weight to be slim?
I have to say again, in case of type 1 diabetes, even if you become thin, you will not recover. However, in case of type 2 diabetes, if you become thin or you become ideal body weight or BMI, your condition would be better. However, it depends on your disease stage and condition, whether you will become perfectly well or partially well.
Thank you. Thank you for your important and interesting idea. Thank you. So that's all. Thank you for joining us and see you again.
Please access to the link below or please access to the minute information of introduction of this program. You can get results and contents and questionnaire in many languages. Thank you for joining us.